I'm sorry, Erin, if you said something to me, I totally missed it because my signal cut out.
I was just letting you know that I went ahead to hit record since it was 1:31, just so I do not forget to hit the record button when we start. It's just now 1:32. You're still the only board member logged in. Do you want to wait just a moment or two longer?
Well, yeah, I think I will.
Okay. I will go ahead and I wanted to make a quick reminder. We've been having a lot of new people join our TACs. So I just want to make a friendly reminder that if you're not on the TAC, please do not vote to approve minutes. Please do not vote on the recommendations. If you have an issue that you would like to discuss in a TAC meeting, I encourage you to reach out to one of the TAC members to put it on the agenda. And also too, when you first introduce yourself with a court reporter, can you make sure to say who you are in your introduction? So that way we're making sure to capture everyone and who is speaking.
It's after, so maybe we should go ahead and start with just introductions.
Yes, ma'am, that works for me. I'll turn it over to you, Miranda.
Okay, so I'm Miranda Brown. I'm a member of the TAC, and my day job is with Kentucky Equal Justice Center, so I'm appointed by that organization to serve on the TAC. I'm a connector, so I enroll people in coverage, and I'm our outreach coordinator at KUJC. So I will pass it off to others to introduce themselves.
Veronica, would you like to introduce anyone? We can't hear you, Veronica.
Sorry, people's face. Is there anybody who wanted to introduce themselves?
Can you hear me now?
Yes, ma'am.
Oh, good. We're in this newfangled, big video system. Veronica Judy Cecil, Senior Deputy Commissioner for Medicaid. And I just want to take just a moment to introduce our new director for the Division of Healthcare Policy, Nicole Bradshaw. Nicole's here with me. Today is her first day. So she is stepping into the shoes of Lee Geis. As you all know, Lee retired at the end of July. So we're excited to have Nicole with us. She was previously in Medicaid back in 2013, 2014 as a nurse service administrator. She had a lot of experience working in program integrity, both with the state's recovery audit contractor and with the federal contractor for recovery She was she worked in the area that covered Kentucky. So she knows a lot about Medicaid policy, about reimbursement. So just really great experience bringing to her position now in healthcare policy.
Thank you, Veronica, and welcome, Nicole. Are there any other TAC members on now, Erin?
No, ma'am, still just you.
I just checked my email, and Christine had let Emily and me know that she was actually not able to make it today, but I haven't heard from any of the others.
If you'd like to move on through your agenda, and then if they log in at a later date, we can always come back and approve your minutes and establish the quorum.
Okay, that sounds good. So the first, then after quorum approval of minutes, is old business, starting with, so we're wanting to know just kind of updates and status on these items, starting with state of DMS proposed spending of a portion of the FNAP funds to pay for the onboarding costs for PDS employees. Is Pam on?
Sorry, I couldn't get a hold of, I couldn't find my unmute button and my camera button at the same time. So this, that was included in the original spending plan. However, because we had to go back and with the 10% rate increase, we had to revise our spending plan. So we are still looking at methods to do that. I don't have any updates on it, Miranda, but we are still, there is still an intent for us to change that so that it is not the employee that has the burden of those costs for onboarding employees. But I don't have really a good update for where we are at this point with that, other than that is still our intent to make that change. We'll just have to do it a way different than using the spending plan and the ARPA money to do it.
Okay, and I think I was trying to remember from last meeting, you had said that you were considering, you were looking at covering the cost of training employees as well. And I guess it's just as part of your update, have you had any like additional meetings?
We have not. We have one coming up with CMS, and we're looking at training overall, kind of in general, down to the PDS employee being in control of what types of training they want the individual to have to take, versus everyone having to have, a certain set. We also are looking at different trainings that we can provide that, that we can give information on that are free of charge. For example, there's one I know coming up on seizures and epilepsy that we have been working with, that we're going to provide that information just out generally to everybody, whether it be PDS or be a traditional agency, that employees can take those kinds of training. So we're really looking at that whole process from top to bottom. So, including onboarding, training, employee management, the whole process.
Right. Thank you, Pam. So next is the PE Medicaid data request that we had put in, and Lee guys hadn't gotten to it before the last meeting. So we had asked about how many Kentuckians were covered under PE Medicaid, basically before the pandemic, or like immediately before, or on average during the year before in 2019. Is that information that we have now?
Yeah, I apologize, Miranda. We have the updated PE number, but I think we failed to make sure that we had this in time for the meeting. So we'll take it back and we'll get it to you by the end of the week. We'll send it to all the members.
That'd be wonderful, Veronica. Thank you.
Yes, I apologize for that.
Understandable with the turnover. So next is DMS disseminating presumptive eligibility and emergency time limited Medicaid flyer. And I think we made a recommendation on this last time and we did get a response. And so kind of just wondering an update on how is this being used or planning to be used, the flyer itself versus even information about these programs.
Yeah, so the commissioner has asked our new communications person to work on a dissemination plan for this. One of the things we want to do is maybe incorporate it into our social media, and then also think about how do we get it out to the folks that would interact with this population. So we're working on that plan right now. I don't have an update on that specifically yet. So if you want to leave it on the agenda, we're happy to try to bring that to you next time.
Okay, thank you. And then we've got the Health Disparity and Equity TAC.
Yes, so excited to report that the first meeting's we will send out to all the MAC and TACs the link to the meeting. And Erin, I'm gonna lean on you a little bit. We don't have that set yet, right?
No, ma'am. I can go ahead and get the Zoom link set. I was just waiting for the website to be established as a whole.
Sure. We're working on the agenda right now. So probably should have that sometime next week. And then we're creating a website specific to this TAC, and we'll be posting that information. So knowing that a lot of folks are interested in this, we'll definitely disseminate that information once we have it finalized.
Wonderful, thank you. So next is the PACE program rollout. Or sorry, I jumped one. We actually have the HCBS Rate Study Work Group.
So we had postponed or had canceled the last two rate study work groups, but we'll be getting back on track with that hopefully by the end of this month, if not the beginning of September. With unfortunately the natural disaster with the flooding and with just some of the other activities that were taking place, we had to dedicate some time to the Appendix K and those activities, but rate study will be, we will be resuming meeting in September. And we hopefully, you know, we'll make up any time that we've lost, but we'll pick back up where we were with, I think we'd started talking about rate buildups in the rate process. So we will begin right where we left off.
Understandable. Thank you for working on that. So then we have the PACE program rollout.
So very excited to report that we enrolled our first member with the PACE organization with Bluegrass Navigators. We enrolled our first individual. He began as of August the 1st. I believe they're going to have their official center ribbon cutting ceremony in the next month. I believe it's scheduled for mid-September. And as of just a few minutes ago, actually, the agreement with our next organization, Horizon, has been signed and has been sent to CMS. So they are looking forward to onboarding someone in the very near future too. We're hoping maybe for September or October to have our next individual onboarded through PACE. So very, very excited for the opportunities that PACE is going to bring for the individuals. We're working very hard on the website and some educational materials that are going to come out that really will help explain more about what PACE is, who's eligible, how to find out about it, how to get connected, that type of information.
And the PACE program is like based at different centers around the state, right?
Correct. Yes, there are each PACE organization serves different counties. And so they are, there are no overlap between those counties. So I do not have those, Miranda. Unfortunately, I don't have them memorized yet, and I don't have them off the top of my head, but it's on the website, as well as I can get that information and send it out through you all to be distributed to your members. But yes, it's based on each organization. So right now we have the two, we have Horizon and Bluegrass Navigators. We have others that are working through the process of becoming an organization. It's quite a lengthy process with everything that has to happen, including there's a lot of engagement with CMS. But we do have other organizations or providers that are coming on board. It just takes, it's quite the process, and it takes a little bit. But I can get that out to you, the counties right now that are being served, as well as the counties that will be served based on the next groups that are within the process of becoming enrolled and doing everything that they have to do.
Okay, that sounds great. Thank you, Pam. I guess I'm still thinking about the centers. So they're based at these different organizations, and they kind of, PACE is just like filling out their functions.
So PACE, if you think about it, it's the program all-inclusive care for the elderly. So if you think about them as really kind of a mini MCO, they are responsible for providing for all care needs for that individual. So they get a capitation payment each month, and then they are responsible for oversight and providing all of the care to the individuals. Saying organizations is new for me too. I'm not used. That's why you'll hear me sometimes still defaulting back to provider, because that's kind of my normal terminology in the what I have worked in so far with our 1915C waivers. But we really refer to them as an organization because they're very similar to, they're a kind of a mini MCO for the individuals that are enrolled in that program, and that they provide for all of the care needs of that individual and coordinate all of their care. Did that help at all?
Yeah, I'm just trying to picture it. And so how many centers are already like fully PACE programs now and already online?
We have one right now, which is Bluegrass Navigators, and then Horizon, which is our second one. They are at the finish line, really. They're the agreement was signed today, actually just within the last 30 minutes, and has been sent to CMS. And then there are several in the pipeline that are coming. I will get that information to you. That'll I think maybe it'll make more sense when you see it kind of on paper about who they serve and what areas, what counties they serve and what areas they're in. And kind of that general information. And then if you have more questions, or if you want us to go into maybe at the next meeting a little more details, we could always do that as well, to kind of go through like a mini presentation of the program in the next meeting if there was interest in that.
Yeah, and Miranda, we're gonna do we'll be doing we're doing a soft rollout right now. We plan on doing a big rollout, a media blitz about it, and then we'll start really promoting it. But we wanted to ensure that our system was working appropriately and making sure the person was eligible. The provider is, the PACE provider is ready to bring on, additional people to serve. And so it's very much a soft rollout, and then we'll have a big kind of kickoff.
Okay. Thank you. That is exciting.
Mm-hmm.
So I just looked at the participants list. I didn't see any other TAC members. Am I missing anybody who did?
No, ma'am. I haven't seen them.
Everybody ran when they found out I was going to chair today, huh?
It's not normal for you guys.
I know. Okay, the next item on the agenda is the Kentucky Medicaid Quality Strategy Project.
Hello, Miranda. It's Angie Parker, Medicaid. We have received the first draft from our Northern Kentucky University review. So it should be coming for public comment in the very near future. Any questions?
Okay, I've joined from my computer. Sorry about that. Let me see if I have any questions. I'm thinking. I don't think that's pretty straightforward. I don't think I have any questions. Next is the stakeholder engagement opportunities regarding public health emergency unwinding.
So I will share that we did expect a CMS notice by August 14th that they would not extend the 60-day, the public health emergency. We did not receive that 60-day notice. So at this point, we anticipate another extension of the public health emergency. We are in the process of still kind of working through some internal steps, but we are planning a very robust stakeholder engagement. We're just not there yet.
Do you have an idea of the timeline as to, are you like how far in advance of the public health emergency ending before you want to involve stakeholders?
Yes, so we would have, if not for now, the lack of the 60-day notice, I think we would have already been engaging, starting to kick off our communication strategy. So at this point, my guess is it'll be at least another 30 to 60 days before we take that on.
Okay, I'm just thinking it would be good to have stakeholder involvement early on in the process to help things run smoothly when it hits. Okay. I just sent out an email to the other TAC members to make sure they had the correct link. We'll see if that helps. I know we're getting pretty far down the agenda already. Next is maternal health review.
Hello, Miranda. This is Dr. Terrio. I don't have too much to report. The 12 months postpartum coverage went into effect as of April 1st. So that is already occurring. We're working, the newest thing that we're working on is a maternal health dashboard. And so we want to get, a dashboard that has kind of important information such as C-sections, premature birth, things like that on one piece of paper or one computer screen that you can look at that will help give you a snapshot about how we're doing taking care of our moms, new moms, and women that can be pregnant. So we're working on that. I'm very excited about that. So more to come on that. We're working with our MCO partners, still looking into postpartum care and trying to, we have a lot of great things in place, but trying to see what types of things are being utilized and what aren't, what are the barriers, for example, to getting to a postpartum care visit, and what can we do to address some of those barriers. So, so it's lots of good things happening, and we'll just keep you guys up on things as they develop.
Thank you, Dr. Thoreau. That's awesome. And I was wondering about, I know the SPA, the SPA also was regarding removing the 5-year wait for lawfully residing pregnant women, pregnant individuals. And so for that and for the extended postpartum care, maybe less so for that because people are already enrolled at that point. I'm wondering what kind of plan there is for making sure that connectors know about that so that they can, you know, properly outreach and go ahead and tell pregnant individuals, yeah, you might be eligible because there's no longer that 5-year wait. It's just important new update for connectors.
Yeah, Miranda, we are, that's in process. And we also plan a campaign, advertising or marketing campaigns specific to the presumptive eligibility, to the extension of the postpartum. So we're working on those things right now.
Awesome. Yeah, very excited to find out about these updates. It's a game changer for a lot of individuals, so thank you. So next on the list was next steps for Medicaid reimbursement for licensed certified professional midwives. I think this was addressed at the MAC meeting, but is there any further information that anyone can provide?
No change in status.
Is it something that's under review for potentially doing in the future?
Not in the near future, as the commissioner mentioned on the MAC.
Okay. Thank you, Veronica. That takes us to new business. We still don't have any TAC members joined.
No, ma'am.
Okay. I don't want to trip over them if they're there. So new business, we have the data requests that we always get an update on how many Kentuckians are currently covered under traditional versus expanded Medicaid and PE.
Yes, give me 1 second. So currently for presumptive eligibility, we have, so, and keep in mind, this is a snapshot. So the snapshot dated August 15th is that we have 1,574 people enrolled in presumptive eligibility. For just 1 second, for traditional, and let me get into my document that I should have had up, but I don't because I'm not at my desk. 1 second. Let me pull up the other enrollment numbers. Okay, so as of Monday, again, it's a snapshot. We have a total of 1,664,616 unduplicated members. Of that, we have in our expansion population, we have 619,140. And we also have in managed care, we have 1,506,517. And in our SKY program, we have 27,831.
Okay, thank you. And then we have the feedback on the network adequacy one pager. Thank you so much, Angie, for pulling that together.
Well, thank you and Emily for your feedback. I didn't know whether or not you had any other feedback from any of the other TAC members. That hasn't been completed, but based on your feedback, but we'll have that back to you for further review once it's completed.
Okay, great. Yeah, I didn't see any other feedback from other TAC members, but I think Emily asked a question in her email about shouldn't the out-of-network services be available when any of the network adequacy standards are not met? I don't know, did you have a response? Did you have information regarding that question?
Well, I mean, certainly that could potentially be an alternative to that, but the MCOs would have to work with the particular providers in the area to see if there are any providers who could provide that particular service. It may be out of network for one MCO, but not the other. So there's a lot of weighing into the type of provider that is needed to determine if there is truly a network adequacy for that one MCO, or is it indigenous of the area.
Okay. So she also asked if it was CMS's policy that the enrollees switch MCOs rather than requiring the MCO they're currently enrolled with to provide an adequate network. So that I think your answer kind of addresses that.
Now what we expect is an adequate network. There are, as we know, there are challenges for all MCOs in certain areas, but no, we would prefer they not change unless that member feels it's best for them, and but they are to work with their MCO to find a provider if they can.
Yeah, so the expectation is that the MCO, if there is a need for a provider that's not in network, is the MCO ensure that coverage and that access, and they might have to enter into what's called a single case agreement with the provider. But as Angie mentioned, it is absolutely the expectation that the managed care organization they're in fact contracted to provide access to those services on behalf of that member. It is not acceptable for them to say they can't find a provider. And we need to know about those situations if that's what's being said.
Okay, that makes me think that maybe that would be a helpful sentence to have somewhere in the one pager, that, you know, if the MCO is not working with the patient to figure out a solution, that the member have a route to report that issue.
Yeah, they should file a complaint. Absolutely.
Is that something that we can add to the one pager, Angie?
Yes, I'll look at that. As I said, with your comment, with your feedback, Emily's, and with this discussion, I can update that and send it back out to you all.
Sounds good. Thank you.
Mm-hmm.
Now, I will say all that, Miranda, that there are some situations where perhaps the member does want to go to somebody specifically, and that person is not in network, and that person has no interest in even entering into a single case agreement. At that point, the only MCO responsibility is to ensure that there is access to that service. And if that member refuses to go to somebody else, you know, that's a whole totally different situation that has to be dealt with. But those are some of the things that do happen. But I think generally the response is that if, you know, the member is just looking for somebody to deliver the dental service, it is a responsibility of the MCO to find a provider available.
Yes, that definitely makes sense. You can't, they're not set up to cover all providers. That's just part of how it works. I understand that. Okay, well, thank you, Angie, for revising that, and we look forward to an updated version to review. Nobody has responded to my email other than Emily herself, who is not attending today. So I think as far as the next item, which is just general discussion, additional items for discussion, let me look at my list to see if I had anything else I wanted to bring up. Last time we talked about vaccination rates, and each of the MCOs gave an update on COVID and routine childhood immunizations. So I think that would be helpful to get another update if any of the MCOs are still on and would like to share.
Yeah, although they might not be prepared to do that. I'd recommend, if you want, to add it to old business, just as a recurring report if you'd like. But we could, I don't know if any of the MCOs are prepared to speak to their updated immunization rates.
I'm happy to give a brief update if that's okay. I'm with Anthem Medicaid. Victoria
Yes,
Jude.
please go ahead. Thank you, Victoria.
Okay, you're welcome. So for Anthem Medicaid, our percentage of overall membership vaccinated is at 35.82%, with a total injections of 130,119 members. Our member counts for fully vaccinated is 55,156 members, with partial vaccination counts at 6,423. Our members boosted is 17,379. And among the trends around our age groups, we are still leading in a 60 percentile, 61.9% with those 65 and over. And then next to that, obviously, is the ages 50 through 64 with a 52.5%. And from there on, it goes from 41.8%, 40 to 49, 30 to 39 is 37.8%. 18 to 29 years old is 35.7%. 16 to 17-year-olds is at 29.5%. 12 to 15-year-olds is 21.5%. 5 to 11-year-olds is 6.4%. And then 0 to 4-year-olds is at a 0.4%. We have, as far as race, we have Asian or Pacific Island at 52.76%, white non-Hispanic at 32.08%, Hispanic at 27.94%, Black 30.37%, Native Hawaiian 25.34%, American Indian 31.34%, and other 21.63%, and then we're at a 34.60% for those not provided. We are currently collaborating with the Kentucky Association of Health Plans and the other MCOs to support the broad COVID vaccine events going on, including our upcoming state fair vaccine booth that we're volunteering at, where there'll be a $25 gift card and wristband provided. We are still continuing with our $100 member incentive and our $50 provider incentive that will run through 2022. And we're continuing the direct member education and outreach. We did, for August, do a partnership with WKYT that focused on a 4-minute segment around the importance of back-to-school vaccines. And we did a 2-minute segment calling out HPV vaccines, really building that education around the cancer prevention aspect among the both male and female. We also have our partnership going on right now with the Coalition for Homeless as far as a training series addressing different SCOH needs, and that some of those will include local resources and experts in the field on vaccinations and access to healthcare. We have the Ready to Launch, Ready, Set, Renew marketing campaign going on for members once PHE is lifted. We're currently planning, from a community outreach perspective, upcoming flu and COVID vaccine clinics for the fall. And we're wrapping up our back to school events where we did a back to school style tour and brought in registration booths from local community partners around immunizations and HPV vaccines for our back to school initiative that went statewide. And that is all the updates I have at this moment. Do you guys have any questions? I'm happy to follow up in an email if needed as well.
Awesome, thank you. Can you just repeat, I was kind of swimming in the numbers. Can you repeat the percentage of total members that are fully vaxxed versus partially vaxxed?
Yes, so fully vaxxed is 55,156 members, and partially vaxxed is 6,423 members. And I'll give you a visual in the chat if that's okay.
Perfect, thank you. And thank you for putting in the chat, Samantha, that you would provide rates via email. That's great. Any of the, excuse my computer's noise just now. Do any of the other MCOs want to provide an update?
Hi, Miranda. It's Ashley Hobbs from United. I was able to pull what our vaccination percentage looked like. This is just for one vaccine. It is at 44.14% of our members, but I will also send some more information via email after the meeting.
Miranda, could you put your email in the chat and then I'll just do the same?
Sure.
Thank you.
And anything you send my way, I can share with the rest of the TAC. Okay, any other MCOs are on?
Hi, this is Anna Page from Passport. We too will send you the information, Miranda, in an email.
Awesome, thank you. So I do not have other items for general discussion.
Brian, if I could just say, so I just want to make it clear, MCOs, make sure you send that to Aaron, and Aaron will get it to all the TAC members so that we know what's being sent, okay?
Thank you, Veronica. Aaron, are you able to put your email in the chat?
I just dropped it down there.
Maybe you sent it to an individual. I can't see it yet.
Apparently I sent it to the waiting room where there's nobody at. Sorry about that.
That's funny. I wish there was someone in the waiting room. I wish there were some other members on here. Thank you, Aaron. Okay, so that takes us to recommendations, which we cannot make since we do not have a quorum. And then there's the MAC meeting representation. So this is a new item that we have on here. Is that just confirming who's going to give the report for the MAC meeting?
Yes, ma'am. We added that on there just so I can kind of keep track if someone's going to be there. That way, if they're not, I can just let the board know as they're going through each TAC that there's not a representative.
Okay. Well, we do plan on having a representative, and Emily said that she could do it as usual if I just provide her the report out. So that's what we're planning on at the moment. And then Next is just a review of our upcoming meetings. We will be meeting October 18th and December 20th, both at 1:30 p.m. Eastern. And then we have the MAC meeting dates listed there as well.
And Miranda, I wanted to let you know, I am working on the calendar for the upcoming year, and I hope to get that out to everybody soon so they can start looking at the dates and make sure. I just try to follow along with the date structure you guys had for this year and just follow that into next year. But I hope to have that out in the next week or two.
Awesome, that would be great. So we can start looking at those for the next meeting. Thank you so much. And thank you everybody for being here. Thank you MCOs for providing information on a whim. Appreciate all of that. Normally our meetings are much longer, but and there's really nothing else on the agenda unless, Erin, do you have anything else?
No, ma'am, I don't.
Okay. Well, I think we can adjourn and hopefully we will have a quorum at our next meeting and be able to take care of some business then. Thank you all.
Thank you, everybody. Have a great afternoon.
You too.
Thank you.
Good afternoon. Goodbye.